Let's chat about boobs. October is Breast Cancer Awareness Month. So I wanted to talk to you about the ways that you can reduce your risk of breast cancer and also the warning signs of breast cancer. Now, I am not a doctor and I am not offering you medical advice. The information I'm about to share with you comes from the Centers for Disease Control and Prevention, the CDC. I did some research online with several different websites and they all kind of say the same thing. I've settled on the CDC, and I will put a link in the description down below with the information that I found so you can read it from their source. But I want to talk to you about breast health and opening up a dialogue with your doctor. Mammograms are an easy test. They literally take about 5 minutes. And they're recommended for women 40 years and older. Unless you have a problem that arises, you might get one younger. But you should also get a breast exam regularly by your doctor in person and learn how to do a self-exam as well. Here are some warning signs to look for according to the CDC. If there is any change in the size or shape of your breast, if there is any pain in your breast, if there is any discharge from the nipple of your breast that isn't breast milk, if there is any lump in your breast or in your underarm area. So if you experience any of these symptoms, you want to see your doctor right away. These symptoms don't necessarily mean that you have cancer. So I want to share some personal stories with you. Very recently, I was experiencing some discomfort, some sensitivity in my right breast right here. So I went to the doctor and he asked me some lifestyle questions. Have I gained any weight? Have I lost any weight? You know, did I have any trauma to the breast? Anything like that? We came to the conclusion after he gave me a breast exam and he didn't really find anything, that because I've been staying home due to the coronavirus and I work from home often, I haven't really been wearing a bra in the house. I haven't been wearing anything very supportive. So he concluded that it was the weight of my breast that was pulling on it and causing some discomfort. He also sent me for a mammogram, which I went and I did, and everything came back okay. So that's one story. So just because you have some sensitivity or pain doesn't mean that it's anything really horrible, okay? Another story, when I was a young girl and I was in college, I actually found a lump in my underarm. And I told my mom about it and she felt it too, and she took me to the doctor the next day. And he gave me my very first breast exam and he said that it was really nothing, it was from shaving. So I guess it was a clogged pore or something like that from shaving and then putting on antiperspirant right away. So even if you find a lump, it doesn't necessarily mean that you have cancer, but you should always go get anything checked out with your doctor. And it's always better to know and get that feeling of peace of mind of having someone professional examine you, or to actually get a mammogram and get the results back that are good. I want to encourage you to please do not put off your mammograms. They are so easy. They literally take 5 minutes. And every time I've had a mammogram performed, it's always been a woman who's done it for me. So you don't have to feel shy or modest in any way. They don't care what your breast looks like. You know, they do them all day long. A boob is just a boob to them. It's something that they're examining for your health. So don't put it off. It's an easy test and it doesn't take any time. So in between your mammograms, you should practice self-examination. Now, some doctors will send you for a mammogram every year. Some will send you every 2 years. They really don't start sending you for mammograms until you reach the age of 40, unless there's a problem. So it's important to learn how to do self-examination. So if you find anything, you can bring that news to your doctor, and to get your yearly medical checkups as well. So here are some of the ways the CDC recommends lowering your risk factors for breast cancer. One is to maintain a healthy weight. Another is to exercise regularly. Another is to limit alcohol consumption. Now, this doesn't mean that you can't ever have alcohol. It just means to drink it moderately and don't excessively drink alcohol. To breastfeed your children if possible. Now, not everyone has children, of course, and not everyone wants to breastfeed, but it is something that helps. And if you take any kind of hormone replacement therapy or birth control pills, you should also discuss with your doctor about the risks associated with those. Most breast cancer is found in women 50 years and older, but that doesn't mean that younger women can't get it as well, which is why you really should learn how to do self-examination. And it's something that's easy to learn. I think I learned it from a women's magazine when I was a teenager. You can probably ask your doctor how to do it. I'm sure you can find a video online of how to properly perform a self-examination. Now, it's very rare, but men can also get breast cancer too. I just thought I'd point that out. Now, I'd like to add that good nutrition is important in preventing all types of cancer. The Mediterranean diet especially is the best diet in the world for helping to prevent disease like heart disease and cancer in men and women. Personally, I have a few other tips for you that I use on myself. I don't use antiperspirants any longer that contain aluminum. I use all natural deodorants. Now, there's no definitive proof that antiperspirants cause breast cancer, but it is talked about a lot and something you should be aware of. Also, if you use any kind of dusting powder, you want to make sure that you use one that does not contain talc. There are healthier kinds of dusting powder that contain cornstarch or arrowroot powder or kaolin clay. So if you do use dusting powder, you want to look for something like that. Also, if you experience any kind of trauma to your breast, or like if you're in an accident and your breast gets bumped, or if someone punches you in the breast, and I know that seems a little far-fetched, but it can happen. If there's any kind of trauma with your breast, you want to go see your doctor right away. Also, this one probably goes without saying, please do not smoke cigarettes, because that is known to lead to all types of cancers, and I don't understand why anyone would willingly try to give themselves something that can do them harm. So there you have it. October is Breast Cancer Awareness Month, so it's a good time to either get your mammogram, get an exam by a doctor, or learn how to do a self-examination and take care of your breasts. I hope you found this video helpful. I'll put some links down below where you can get more information, and I will see you soon. Bye!